Hey folks, Dr. Alan Mandell here, and I want to start today with a very simple question. When you look down at your legs, your ankles, your feet, do you notice that they look a little puffy? Maybe your shoes feel tighter by the end of the day. Maybe you press your finger into your ankle and it leaves a little dent. Maybe you've just been chalking it up to getting older and leaving it at that. Well, I need you to stop and pay close attention to what I'm about to share with you, because what I see in my practice every single week is this. Millions of Americans over the age of 60 are walking around with swollen legs, and they have absolutely no idea that the very medications they're taking to stay healthy may be the reason why. Today, I'm going to walk you through 5 simple tests you can do right now, right at home, with nothing more than your own 2 hands to help figure out whether your medication could be responsible for that swelling. These aren't complicated. You don't need a lab. You don't need special equipment. You just need to know what to look for. And after watching this video, you will. So let's get into it. Before we get to the tests, I want you to understand why this happens, because once you understand the mechanism, everything else makes sense. Your body is constantly managing a very delicate balance of fluid in your bloodstream, in your tissues, and in the spaces between your cells. When everything is working right, that fluid stays where it's supposed to be. But certain medications can throw that balance off. Some drugs cause your blood vessels to relax and widen, which sounds like a good thing, and for blood pressure it often is. But that widening can allow fluid to leak out of the vessels and pool in the lower legs, especially because gravity is constantly pulling everything downward. Other medications tell your kidneys to hold on to sodium, and when your body holds sodium, it holds water along with it. That water has to go somewhere, and it tends to settle in the ankles, the feet, and the lower legs. Now, this kind of swelling has a medical name, peripheral edema, and it is one of the most commonly reported medication side effects in adults over 60. Yet, it is one of the most commonly missed because both doctors and patients often assume the swelling must be coming from something more serious, like the heart or the kidneys. So let me give you the short list of the medication groups that are most frequently responsible. See if any of these sound familiar to you. Number 1. Calcium channel blockers. These are blood pressure and heart medications. The most well-known ones are amlodipine, you might know it as Norvasc, and nifedipine. These are extremely effective medications, but leg swelling affects up to 30% of patients who take them, particularly at higher doses. Number 2. NSAIDs, non-steroidal anti-inflammatory drugs. These are pain relievers like ibuprofen, Advil or Motrin, and naproxen, Aleve. Many seniors take these regularly for arthritis pain. They cause the kidneys to retain sodium and water, which drives up swelling. Number 3. Corticosteroids. These are anti-inflammatory medications like prednisone. If you've ever been on a course of prednisone for a flare-up, you may have noticed your face or legs puffing up. That's the corticosteroid effect, significant sodium and fluid retention. Number 4. Certain diabetes medications, specifically the class called thiazolidinediones. Medications like pioglitazone, brand name Actos. These are known to cause fluid retention in a meaningful percentage of patients. Number 5. Gabapentin and pregabalin. These drugs, sold as Neurontin and Lyrica, are used for nerve pain, seizures, and even anxiety. Peripheral edema, meaning swelling in the extremities, is listed as one of the most common side effects. And number 6, hormonal medications. This includes estrogen therapy and some testosterone preparations. Hormones significantly influence how your body manages fluid retention, and swelling of the legs is a documented side effect. Now, and this is important, I am not telling you to stop taking any of these medications. Please do not do that. What I am telling you is, if you are on any of these and you have swollen legs, there may be a direct connection. And the 5 tests I'm about to show you will help you figure that out. The core message I want you to take from this section is simply this: swelling in your legs is not always a disease. Sometimes, very often in fact, it is your medicine. All right, let's get to the tests. Test 1, the pitting edema press test. This is the most fundamental test, and it's the first thing I do when a patient comes in complaining of leg swelling. It's called the pitting edema test, and you can do it on yourself in about 10 seconds. Here's what you do. Take your thumb, or your index finger, and press it firmly into the skin just above your inner ankle bone, or on the top of your foot. Press down firmly and hold it there for 5 full seconds. Count it out. 1, 2, 3, 4, 5. Now release. Look at the spot where you pressed. Does it spring right back to normal? Or does it leave a visible indentation, a little pit or dent in the skin? If the skin bounces back quickly and looks smooth, that's a negative test. Good. But if you see a visible dent, a pit in the skin that takes more than 15 seconds to fill back in, that is what we call pitting edema, and it's a positive result. Now here's what this tells us. Pitting edema forms when there is excess fluid stored in the tissue beneath the skin. When you press, you're essentially pushing that fluid out of the way, and it takes time to redistribute back, which is why the pit remains. Here's the key point for today's topic. Drug-induced edema almost always produces bilateral pitting edema, meaning both legs are affected, roughly the same amount. If you press both ankles and both show the same kind of pitting, that pattern is very characteristic of a medication-related cause rather than something like a blood clot, which typically affects only one leg. The severity of the pit matters too. A small, shallow dent that fills in within 30 seconds is grade 1, mild. A deeper pit that lingers for a minute or more suggests more significant fluid retention. In either case, if the test is positive and you're on any of the medications we just mentioned, you've got a strong first clue. Test 2, the symmetry check. For test 2, I want you to grab a measuring tape. A soft fabric one, like a tailor's tape, works best. If you don't have one, a piece of string and a ruler will work just fine. Here's what you're going to do. First thing in the morning, before you've been up walking around, before you've had anything to eat or drink, sit in a chair with both feet flat on the floor. Now measure the circumference of your ankle, right at the narrowest point just above the ankle bone on both sides. Write down both numbers. Here's how to interpret what you find. If both ankles measure within about 1 centimeter of each other, they're essentially the same size, that symmetrical pattern is a hallmark of drug-induced or gravity-related edema. Medications affect the whole body's fluid balance, so both legs swell roughly equally. But if one leg is noticeably larger than the other, say more than a centimeter difference, that asymmetry is a red flag. Unilateral swelling in just one leg, raises concern for something mechanical going on, a blood clot in the deep veins, what we call deep vein thrombosis or DVT, a localized infection, a blocked lymph node, or a structural problem in the joint or tissue. Asymmetrical swelling is the kind of finding that should have you on the phone with your doctor, not tomorrow, today. But symmetrical swelling that started after a medication change, that's the pattern that points squarely at your pill bottle. Keep that number. We're going to use it again in Test 4. Test 3, the morning versus evening comparison test. This one doesn't require anything except your eyes and your phone camera, but it may be one of the most revealing tests of all. Here's the instruction. Photograph your ankles and lower legs twice a day for 3 days straight. Once first thing in the morning, as soon as you get out of bed, before you've been standing for more than a minute or two. And once in the evening, around dinner time, after a normal day of activity. Compare the photos side by side. What are you looking for? You are looking at whether the swelling changes significantly throughout the day. In drug-induced edema, there is almost always a very clear and consistent pattern. The legs look noticeably better in the morning and noticeably worse by evening. Why? Because when you're lying flat overnight, gravity is no longer pulling fluid down into your lower extremities. The fluid redistributes. The swelling partially or fully resolves. Then during the day, as you sit and stand and walk around, gravity does its work again, and the fluid accumulates right back where it was. This gravitational, position-dependent pattern is extremely characteristic of medication-related or venous insufficiency-related swelling. It's a benign mechanism, though not comfortable, and it's very predictable. What you do not want to see is swelling that looks the same or worse in the morning as it did at night. Swelling that doesn't respond to lying down and resting suggests the fluid isn't moving freely, which can point toward cardiac involvement, lymphatic obstruction, or other causes that need medical evaluation. So if your photos show significant improvement overnight and a gradual return of swelling through the day, you've just identified a critical pattern. That's Test 3 telling you something important. Test 4, the medication timeline test. Now this test doesn't involve touching your legs at all. It's a paper and pencil exercise, or your phone notes app if you prefer. And it may actually be the most powerful of the 5. I want you to become a detective about your own medication history. Here's the exercise. Make a simple list. On the left side, write down every medication you are currently taking, prescription and over-the-counter. Include supplements if they're significant ones. Next to each medication, write down approximately when you started taking it or when the dose was last increased. Now, on the right side, write down when you first noticed the leg swelling. Try to be as specific as you can. Was it a month ago? 6 weeks ago? Did it seem to come on suddenly or gradually? Now, look for the overlap. The medical literature is very clear on this. Drug-induced peripheral edema typically appears within 2 to 8 weeks of starting a new medication or increasing the dose of an existing one. That is the window, 2 weeks to 2 months. If you look at your list and you see that a new medication or a dosage increase happened right inside that window before your swelling started, you have found a clinically significant correlation. That is not a coincidence. That is cause and effect. Calcium channel blockers like amlodipine are notorious for this. Many patients will tell me, "My legs started swelling, and I don't understand why." And when I look at the chart, sure enough, they were put on amlodipine 6 weeks ago, or their dose was bumped from 5 milligrams to 10. Bring this timeline with you to your doctor. Write it out clearly. A good physician will take one look at that timeline and know exactly what you're suggesting. You are not telling them how to do their job. You are giving them information that will help them help you faster. Do not stop your medication on your own. I'll say that again. Do not stop your medication on your own. Blood pressure medications, diabetes medications, steroids, these can cause serious harm if discontinued abruptly without medical supervision. What this test does is give you the evidence you need to have an informed conversation with your doctor about alternatives, dose adjustments, or additional management strategies. Test 5, the Elevation Response Test. And here is our fifth and final test, and it's a therapeutic test as much as a diagnostic one, because it tells you whether your swelling will respond to a simple mechanical intervention. Here's what to do. Lie down flat on your back, on your bed, your couch, wherever you're comfortable. Take 2 pillows and place them under your lower legs so that your feet are elevated above the level of your heart. We're talking about 6 to 12 inches of elevation. You want gravity working in your favor for a change. Stay in that position for 20 minutes. Set a timer. When the 20 minutes are up, stand up slowly. Take your time, don't rush, and look at your ankles. Compare them to how they looked before you lay down. Is the swelling noticeably reduced? Does your skin feel less tight? Are the indentations less pronounced? If the answer is yes, if elevation produced a clear, visible reduction in swelling within 20 minutes, that is a very encouraging sign. It means the fluid in your legs is mobile. It responds to gravity, and it moves when you give it the chance to drain back toward the body's core. That pattern is consistent with drug-induced or gravitational edema. If, on the other hand, the swelling shows little or no change after 20 minutes of proper elevation, the fluid may be stuck, bound within the tissues, or building up faster than simple repositioning can overcome. That suggests a more complex mechanism at work, potentially cardiac, renal, or lymphatic, that needs professional evaluation. One important caution. If you have been diagnosed with congestive heart failure, I want you to check with your physician before using prolonged leg elevation. In some forms of heart failure, rapidly mobilizing fluid from the legs can temporarily increase the fluid load returning to a weakened heart, which can worsen symptoms. Your cardiologist will guide you on what level of elevation is safe for your specific situation. But for the majority of seniors without significant heart failure, elevation is safe. It's free, it's effective, and it immediately tells you something critically important about the nature of your swelling. Now I need to pause everything and talk to you very directly for a moment. The 5 tests I just showed you are tools to help you identify patterns and gather information. They are not a substitute for medical diagnosis. They are a starting point, a way for you to become a smarter, more informed advocate for your own health. But there are certain signs, certain combinations of symptoms, where I don't want you sitting at home running tests. I want you on the phone with your doctor or going to urgent care. Right now. Today. Call your doctor immediately, or go to the emergency room if you experience any of the following. Swelling in only one leg, especially if that leg is also warm to the touch, tender, or appears reddish or discolored. This combination is a classic presentation of deep vein thrombosis, a blood clot in the leg. A DVT is dangerous because the clot can break free and travel to the lungs, causing a pulmonary embolism, which is life-threatening. This is not a wait-and-see situation. Swelling combined with shortness of breath, chest pain, or pressure in the chest. If your legs are swelling and you're having trouble breathing or feeling tightness in your chest, that could indicate acute heart failure or a pulmonary embolism. Call 911. Swelling that has come on rapidly, significantly worsening within 24 to 48 hours without an obvious explanation. Rapid onset edema demands urgent evaluation. Skin that is stretched, shiny, hot, red, or breaking down. If the skin over the swollen area looks like it's under extreme pressure, blistering, weeping fluid, or showing open sores, this is a serious complication that needs prompt medical attention. Swelling accompanied by fever. This raises the possibility of a systemic infection or inflammatory process. Please hear me on this. I give you these tests because knowledge is empowering, but wisdom is knowing when to hand the baton to a professional. If you see any of those red flags, don't test, call. All right, let's say you've done the 5 tests. You found a pattern. You think your medication might very well be the cause of your swollen legs. What do you do with that information? Here is a simple, practical, 4-step plan. Step 1. Document everything. Write down the results of each test. Did the press test show pitting? Were the measurements symmetric? Did the swelling improve overnight? What did the timeline reveal? Did elevation help? Having this information organized and written down, even on a notepad, transforms you from a patient who says, "My legs are swollen," into a patient who says, "Here's what I found, here's the pattern, and here's when it started in relation to my medication change." That is a completely different conversation. Your doctor will appreciate the detail, and you'll get better care for it. Step 2. Do not stop your medication on your own. I know I've said this before, but it bears repeating because it is critical. Some medications, blood pressure medications, corticosteroids, diabetes medications, can cause serious, dangerous withdrawal effects or rebound reactions if stopped abruptly. The goal is not to stop your medication. The goal is to have an intelligent discussion with your doctor about whether an alternative medication exists that manages your condition with less edema risk, or whether a dose adjustment might reduce the severity of the side effect. For example, if you're on amlodipine and experiencing significant leg swelling, your doctor may be able to switch you to a different class of blood pressure medication. There are many options. You don't necessarily have to choose between your blood pressure being controlled and your legs being comfortable. Step 3. Support your body in the meantime. While you work through this with your physician, there are several safe lifestyle measures that can meaningfully reduce the swelling you're experiencing. Reduce your sodium intake. Salt makes your body hold water, period. Aiming for less than 1,500 milligrams of sodium per day can make a noticeable difference in fluid retention. Consider compression stockings. Good quality knee-high compression socks, 15 to 20 millimeters of mercury or 20 to 30 millimeters of mercury if your doctor recommends it, can significantly reduce gravitational pooling of fluid in the lower legs. Put them on first thing in the morning, before you've been standing. Move regularly. Short walks throughout the day, even 5 to 10 minutes every hour, activate the calf muscle pump, the natural mechanism your legs use to push blood and fluid back upward. Sitting still for long periods is one of the worst things you can do for dependent edema. And practice elevation, our test 5, as a regular daily habit. 20 minutes in the morning, 20 minutes in the afternoon. Consistent elevation is one of the most effective and underused tools for managing leg swelling. Step 4. Ask your doctor specifically about timing. Some medications, depending on how they work, may cause less swelling when taken at a particular time of day. This is not universal, but it's a question worth asking. Is there an optimal time of day to take this medication that might reduce the fluid retention side effect? Your pharmacist can often answer this question as well, and pharmacists are an incredibly underutilized resource when it comes to managing medication side effects. All right, my friends, let me bring this all together for you quickly. We covered 5 tests today that can help you identify whether your medication is responsible for your swollen legs. Test 1. The Pitting Edema Press Test. Press your thumb into your ankle for 5 seconds and see if a dent remains. Test 2. The Symmetry Check. Measure both ankles in the morning and compare. Drug-induced swelling is symmetrical. Test 3. The Morning versus Evening Comparison. Photograph your legs morning and evening. Drug-induced edema improves overnight. Test 4. The Medication Timeline Test. Map your medication history against when the swelling started. The 2 to 8 week window is the clue. Test 5. The Elevation Response Test. Elevate your legs above your heart for 20 minutes. Drug-induced swelling responds to gravity relief. And remember the red flags. One-sided swelling with pain. Swelling with shortness of breath, rapid worsening, or skin breakdown. Those are your signals to call your doctor today. I want you to feel empowered by this information because you are your own best health advocate. Your body is giving you signals every single day. The more you understand what those signals mean, the better decisions you can make, and the better conversations you can have with your healthcare team. You're not just a passive bystander in your own health. You are an active participant, and that makes all the difference. If this video was helpful to you, please give it a thumbs up. It truly helps this channel reach more people who need this information. And if you know someone who's on daily medications and has been struggling with leg swelling, please share this video with them. You could be giving them the answer they've been looking for. Make sure to subscribe and hit the notification bell so you don't miss our next video, where we're going to be talking about the #1 natural supplement that has real clinical evidence behind it for reducing water retention and leg swelling in older adults. You are not going to want to miss that one. I'm Dr. Alan Mandell. Stay informed, stay proactive, and I'll see you in the next video. Take care, everybody.